licensed clinical social worker here in San Luis Obispo County for the Behavioral Health Agency. Today I'd like to talk to you about reluctance to engage in behavioral health treatment from communities of color as well as other underserved communities. One of the biggest taboos when it comes to communities of color is the stigma around mental illness and additionally seeking behavioral health treatment. Whether it's navigating feelings of depression, anxiety, or thoughts of suicide, there is a long-standing belief in many communities of color that these issues are private and thus talking or sharing about them becomes problematic. This often leads individuals to having a higher rate of a poor overall mental health as well as poor rates of engagement in treatment services. In many communities of color, there is a long narrative of resiliency, with thoughts such as, after all, my people have overcome slavery and loss of their native land. Surely I can get over some sadness. It begins to warp the idea of what mental illness looks like. But mental illness is far more than just feelings of sadness, and it is not a sign of weakness. It does not discriminate on skin color, sexual orientation, or socioeconomic status. Underserved communities are no different from any other community in the fact that we all want to live a healthy life, physically, emotionally, and mentally. The challenge lies in defining what healthy looks like through the lens of intersectionality. When we weigh in stigma, historical adversities, which include race-based exclusions from health, educational, social, and economic resources, defining healthy community becomes a little tricky. As a healthcare profession, we have to own up to the fact that many underserved communities are still reluctant to engage in treatment. So where do we start? We start by listening and seeking to understand the needs of our communities of color, as well as our other disadvantaged groups, which include the LGBTQ community. Within our county, we begin the conversations around these hard topics through in-service trainings, online trainings, as well as special task groups dedicated to targeting these populations. Lastly, we are committed to changing the narrative, moving away from conversations about mental illness to conversations about mental wellness. Mental health is, after all, far more than just a diagnosis. It's about your overall emotional and mental well-being, including both the positive and negative experiences that we deal with in life and finding healthy ways to cope. San Luis Obispo County's Behavioral Health Agency is continuing to identify new ways to generate positive changes within our system of care for our communities of color as well as other underserved groups. We are moving towards continually finding new ways to address the disparities that historically have led to reluctance in treatment. Here in San Luis Obispo County, we see you, and we hope you see us too.